As an operating department practitioner, you play a vital role in patient care during surgery. One of your most important tasks is patient monitoring. This means keeping a close eye on the patient's vital signs to ensure their well-being throughout the procedure. Monitoring helps us detect any problems early on. Early detection allows us to take prompt action to correct issues and prevent harm. Essentially, it's about being proactive rather than reactive when it comes to patient safety. Imagine a patient's vital signs as a window into their overall health. By carefully observing these signs, we can understand how their body is coping with the surgery and anesthesia. Ultimately, effective patient monitoring is about vigilance and understanding. It's about knowing what to look for, why it matters, and how to respond when things go wrong. Anesthesia is essential for surgery, but it also impacts the body's natural functions. Therefore, we need to track vital signs closely. These signs tell us how the heart, lungs, and circulatory system are working. The key vital signs we monitor are heart rate, which tells us how fast the heart is beating. Blood pressure measures the force of blood against artery walls. Oxygen saturation indicates how much oxygen is in the blood. End-tidal CO2 reflects the amount of carbon dioxide in the breath, and temperature is a basic indicator of overall body function. These vital signs are interconnected, and changes in one can affect the others. For example, a drop in blood pressure might lead to a faster heart rate as the body tries to compensate. Let's delve deeper into each vital sign. A normal heart rate varies, but it's usually between 60 and 100 beats per minute. A rapid heart rate, known as tachycardia, could indicate pain, blood loss, or medication effects. A slow heart rate, or bradycardia, might signal problems with the heart's electrical system or certain medications. Normal blood pressure is typically around 120 over 80 millimeters of mercury. High blood pressure or hypertension can strain the heart and blood vessels. Low blood pressure, known as hypertension, might mean inadequate blood flow to vital organs. Healthy individuals should have an oxygen saturation of 95% or higher. Low oxygen saturation, or hypoxemia, indicates that the body isn't getting enough oxygen, possibly due to lung problems or airway obstruction. End-tidal CO2 measures the amount of carbon dioxide we exhale. It's a good indicator of how well the lungs are removing this waste product. High levels might suggest hyperventilation, which is slow or shallow breathing, while low levels could indicate hyperventilation or rapid breathing. Our normal body temperature is around 37 degrees Celsius or 98.6 degrees Fahrenheit. Fever, known as hypothermia, can signal infection, while low body temperature or hypothermia might result from prolonged exposure to cold or certain medications. By understanding what's considered normal for each vital sign, we can quickly identify any deviations from the norm. Section 4. Monitoring equipment, your eyes and ears. We rely on various tools to monitor patients effectively. These instruments provide us with the data we need to make informed decisions about patient care. The electrocardiogram, or ECG machine, records the heart's electrical activity, displaying it as a waveform on a screen. It helps us monitor heart rate and rhythm and detect any abnormalities. Next, we have the pulse oximeter. This small device, usually clipped to a fingertip, measures oxygen saturation in the blood. It uses light beams to determine how much oxygen is carried by red blood cells. The non-invasive blood pressure monitor, often placed around the upper arm, automatically measures blood pressure at regular intervals. It provides readings for systolic, the pressure when the heart beats, and diastolic, the pressure between beats. Then there's the capnograph. This device measures the amount of carbon dioxide in the exhaled breath. It provides a numerical reading known as ETCO2 and a graphical display of the breathing pattern. Finally, the temperature probe measures body temperature, often placed in the mouth, ear, or rectum. It provides a digital reading of the patient's core temperature. These tools are our allies in patient monitoring. It's crucial to understand how they work, their limitations, and how to interpret their readings. Section 5. Warning signs, recognizing trouble. Vigilance is key in patient monitoring. Recognizing warning signs early can make all the difference. Here are some red flags to watch out for. Sudden changes in heart rate or rhythm. A rapid increase or decrease in heart rate, especially if accompanied by an irregular rhythm, requires immediate attention. A significant drop in blood pressure. Hypertension can indicate poor perfusion or blood flow to vital organs. and should be addressed promptly. Low oxygen saturation. Hypoxemia suggests the body isn't getting enough oxygen, which can quickly become life-threatening. Abnormal end-tidal CO2 levels, high or low ETCO2 levels, can indicate problems with ventilation and require investigation. Rapid changes in temperature. Significant deviations from normal body temperature, whether high or low, can signal serious complications. If you notice any of these warning signs, it's crucial to stay calm and take appropriate action. Section 6. Effective monitoring. Tips for ODP students. Here are some tips for effective patient monitoring. Be prepared. Before the procedure, check that all monitoring equipment is functioning correctly and calibrated. Familiarize yourself with the patient's medical history and any pre-existing conditions. Be attentive. Continuously observe the patient's vital signs throughout the procedure. Don't rely solely on alarms. Trust your instincts if something seems amiss. Document accurately. Record vital signs at regular intervals, noting any significant changes or trends. Accurate documentation is crucial for communication and continuity of care. Communicate effectively. Report any concerns or abnormal findings to the anesthesiologist or surgeon immediately. Clear and timely communication is essential for patient safety. Stay calm under pressure. Emergency situations can arise quickly in the operating room. Remain calm, think clearly, and follow established protocols. Remember, patient monitoring is a continuous process that requires focus and dedication. Section 7. Conclusion. Vigilance is key. Patient monitoring is the cornerstone of safe and effective anesthesia care. As an ODP student, you have a responsibility to understand the importance of vital signs, how to use monitoring equipment, and how to recognize warning signs. Your vigilance and quick thinking can make a life-saving difference. By mastering the principles of patient monitoring, you contribute to positive patient outcomes and a safer surgical environment.